Have you been taking Amlodipine, Losartan, or Lisinopril for months, or even years? If you're over 60, there is something important you may not know. Every day, millions of seniors take blood pressure medication exactly as prescribed. Yet many still struggle with dizziness, fatigue, swollen ankles, poor circulation, memory concerns, and unexpected blood pressure spikes. The surprising part? Many people assume these problems are simply a normal part of aging. But in some cases, they may be connected to how your medication affects your body. Today we'll explore what many seniors are never told about these common blood pressure medications, and what questions you may want to discuss with your doctor. Intro. Welcome to Golden Years Health. If you care about healthy aging, heart health, brain health, and living well after 60, you're in the right place. Before we begin, remember, this video is for educational purposes only and is not medical advice. Never stop or change a medication without speaking with your healthcare professional. Now let's get started. The silent problem. High blood pressure often causes no obvious symptoms. That's why experts frequently call it a silent killer. Many people feel perfectly fine while their blood pressure is quietly damaging blood vessels, the heart, the brain, and other organs. That is exactly why medications like Amlodipine, Losartan, and Lisinopril can be life-saving for many people. But taking the medication is only part of the story. Understanding how it affects your body is equally important. Amlodipine. Let's start with Amlodipine. Amlodipine works by relaxing blood vessels so blood can flow more easily. Many seniors tolerate it well. However, one common issue catches people by surprise: swelling in the feet and ankles. Some people notice their shoes feel tighter by the evening. Others think they're gaining weight. Sometimes they assume poor circulation is getting worse. In reality, ankle swelling can be something worth discussing with a healthcare professional. If you've noticed swollen ankles after starting blood pressure medication, it's worth bringing up during your next appointment. Losartan. Now let's talk about Losartan. Losartan is often prescribed because it can help protect the heart and may also support kidney health in certain patients. Many people do very well on it. However, dehydration can become more important as we age. Some seniors drink less water because they don't feel thirsty as often. Others avoid fluids due to bladder concerns. When this happens, dizziness or lightheadedness can sometimes become more noticeable. If you ever feel faint when standing up, don't ignore it. Talk with your healthcare provider. Lisinopril. Lisinopril is another very common medication. Many seniors take it successfully for years. But there is one side effect that surprises people: a persistent dry cough. Sometimes people spend months thinking they have allergies. Others think they are recovering from a cold. In some cases, medication may be part of the picture. If you've developed an unexplained cough after starting a blood pressure medication, it may be worth discussing with your doctor. What most seniors don't know. Here's the part many people never hear. Medication alone is rarely the entire solution. Healthy habits can work alongside treatment. Some of the most important include daily walking, better sleep, managing stress, eating less processed food, staying physically active, monitoring blood pressure regularly. These habits help support healthy blood pressure and overall cardiovascular health. The brain connection. Researchers continue to study the connection between blood pressure and brain health. One reason this matters is that healthy blood flow helps support the brain. Evidence suggests that controlling high blood pressure may reduce the risk of dementia over time. That's why managing blood pressure isn't just about the heart. It's also about protecting memory, independence, and quality of life. 3 questions to ask your doctor. At your next appointment, consider asking. Question number 1. Is my current blood pressure goal still appropriate for my age and health status? Question number 2. Could any symptoms I'm experiencing be related to my medication? Question number 3. What lifestyle changes could help me support my treatment plan? Simple questions can sometimes lead to important conversations. Conclusion. If you're taking Amlodipine, Losartan, or Lisinopril, don't panic. For many people, these medications are effective and important. But understanding how they work and paying attention to changes in your body can help you become a more informed partner in your healthcare. Remember, never stop a prescribed medication without speaking to your healthcare professional. If you found this video helpful, subscribe to Golden Years Health. Because healthy aging isn't about adding years to your life. It's about adding life to your years.